Lassa fever. Lassa fever. An acute viral hemorrhagic illness caused by Lassa Mammarenavirus, Lassa virus, in the genus Mammarenavirus of the family Arenaviridae. It is a zoonotic, animal-borne, spread by Mastomys, a genus of rodent. It is endemic in parts of West Africa, e.g. Mali, Ghana, Nigeria. The cases including suspected ones should be immediately reported to local and national experts for advice and laboratory testing. Routes of transmission, particularly, it occurs in the absence of adequate infection prevention and control measures. Food or household items contaminated with urine or feces of infected Mastomys. Person-to-person infections. Laboratory transmission. Symptoms. About 80% infected people are asymptomatic and the rest result in severe disease, where the virus affects several organs such as the liver, spleen, and kidneys. The incubation period ranges 2 to 21 days. The onset, when it is symptomatic, is usually gradual, starting with fever, weakness after a few days, headache, sore throat, cough, nausea, vomiting, muscle pain, chest pain, abdominal pain, diarrhea in severe cases, facial edema, pleural effusion, bleeding from the mouth, nose, vagina, or gastrointestinal tract, hypotension, severe late in pregnancy, vary often with maternal death and/or fetal loss in the cases during the third trimester. In the later stages, proteinuria, shock, seizures, tremor, disorientation, altered mental state, and coma. Death usually occurs within 14 days. During recovery, deafness in quarter of the recovered patients, but hearing returns partially after 1 to 3 months in half of them. Transient hair loss. Transient gait disturbance. Diagnosis. Because the symptoms are so varied and nonspecific, the diagnosis is often difficult, especially early in the course. It is difficult to distinguish from other viral hemorrhagic fevers, such as Ebola virus disease, malaria, shigellosis, typhoid fever, and yellow fever. Diagnosis and prompt treatment are essential and they improve survival. Prevention. Good community hygiene, to discourage rodents from entering homes. Storing foodstuffs in rodent-proof containers. Disposing of garbage far from the home. Maintaining clean households, and keeping cats. Avoid contact with blood and body fluids while caring for sick persons. Treatment. Rehydration, supportive care, physical, psychological, social, and spiritual support for patients and their families. Symptomatic treatment eases the symptoms without addressing the basic cause of the disease. Currently no licensed vaccine, under development, ribavirin, not licensed, antiviral drug.